Hello friends, good morning. How are you everyone today? I hope you all fine by the grace of God. Okay. Today I am going to discuss you with some of the questions uh, from acid reflux. Okay. These questions are frequently asked in the exam, so it may be useful for you. Okay, let's start with the first questions. I hope you already know about acid reflux disease, right? Okay. Now the first question is, a patient reports frequent heartburn twice a week for the past 4 months. Okay. What other symptoms reported by the patient may indicate the patient has GERD? Select all that apply. Okay. The first answer is bitter taste in the mouth. Next, dry cough, melena, difficulty swallowing, smooth red tongue, and the last one, Murphy's sign. Okay. Here already patient complaining heartburn, right? Frequent heartburn is there already. So what other symptoms? Okay. Patient may show. Okay. I hope you already answered the questions. Okay. Let's go to the answers. Since it is a select all that apply, no, it may confuse you. But that's why we have to know the content before we answer. So, okay, we practice to know. We have to have the habit of learn content first. Okay. So let's see what are the right answer. Okay. The answer is option A, bitter taste in the mouth, right? This is because of the acid reflux, because of the backflow of the acid in the mouth. And the patient have dry cough, and the patient is also showing the symptom of difficulty swallowing, right? Option C is melena is the not answer, because melena is because of what? Because of the bleeding, GI bleeding. Option E, smooth red tongue, in which deficiency you can see vitamin B12 deficiency cause client to have red tongue or beefy red tongue, right? And the last one, F, is Murphy's sign. This is because this is the Murphy's sign is when the healthcare provider examine the patient abdomen. The patient shows some of the specific pain because of gallbladder palpation. Okay, this sign is from gallbladder disease. Okay, Murphy's sign you can see in the disease of the gallbladder polycystitis may show Murphy's sign. Okay, understand what are the right answer. So you have to know the rationale also had written to make easy for you. Okay. So A, B, D is the right answer. Let's go to the question number 2. Your patient who is presenting with the signs and symptoms of GERD is scheduled to have a test that assesses the function of the esophagus, ability to squeeze food down into the stomach, and the closure of the lower esophageal sphincter. The patient may ask you, what is the name of the test I'm having later today? You tell the patient the name of the test is A, lower esophageal gastrointestinal series, B, trans-esophageal echocardiogram, C, esophageal manometry, and D is esophageal pH monitoring. Okay, now you know the diagnostic test, okay, which is going to done on the patient. Okay, some of the diagnosis test has been given here. You must answer the right diagnosis test because they already explained you patient scheduled to have that assess the function of the esophagus, ability to squeeze food down into the stomach, and closure of the lower esophageal sphincter. Okay, the patient wants to know what is the test called. Okay, it's already explained there. So you're going to answer. Which answer you're going to give? I hope you already answered. Okay, here you have to select one answer only. Okay, you already have different diagnostic test which is done on the patient with the GERD, right? So let's see the answer. Okay, Answer is option C. Okay, this is called esophageal manometry. Okay, esophageal manometry is the test that is used to measure the function of the lower esophageal sphincter and the muscles of the esophagus. Okay, so your answer is esophageal manometry. So what about the option A and option B and option D? Okay, option A what? Option A is the lower esophageal gastrointestinal series. So this is what? Yeah, the test is done by using barium chalky liquid, or that is a barium swallow. Okay, this diagnosis test, this is a series of the tests they are doing on GERD patient, lower GI. Okay, GERD is related to upper GI, right? Yes. And option B is a transesophageal echocardiogram, TEE. Maybe you're thinking, oh, echocardiogram also doing with the acid reflux. No, yes, it is a special type of echocardiogram to view the heart if it is producing blood clot. Okay. Next, the option D is not the right answer because esophageal pH monitoring. What is esophageal pH monitoring? A monitor is attached to the tube to measure the acid levels in the esophagus. Okay, there's a monitor they are going to attach to the tube to measure the acid levels in the esophagus. So the right answer is the C. Esophageal manometry is the test using to measure the function of the lower esophageal sphincter. Understand? And the muscle of the esophagus. Next question. After dinner time, during our early rounding, a patient awakes to report they feel like food is coming up in the back of their throat and that there is a bitter taste in their mouth. What nursing intervention will you perform next? Here, patient is complaining you the food is coming back to the mouth. Okay, that is regurgitation. No, and also patient is feeling bitter taste in their mouth. The taste is bitter. So here they are asking what is your intervention? What you are going to perform next? Okay, when suddenly patient complaining regurgitation, what you are going to do? Okay, answer A is perform deep suctioning. B, assist the patient to semi-Fowler's position. C, keep the patient NPO. Instruct the patient to avoid milk products. Okay, here your intervention, what is your action? Okay, you are making rounds and suddenly patient awakes. Awakes means patient may lie down, right? Patient feeling food is coming back to the throat and also is feeling the bitter taste. So what you will do? Are you going to do suction? Why we need to do suction? Okay. The next immediate action is what? Are you going to keep the patient NPO? No, right? Instruct the patient to avoid milk products. Okay, this you instruct. It's a teaching plan. Okay, you're giving teaching plan. You have to instruct the patient. But why need to keep NPO? Why we need to do suctioning? No, they are asking what nursing intervention. You will understand the question. The patient is awake. Awake. Maybe he lie down, right? So assist the patient to semi-Fowler's position. Okay, the next what you're going to do? Answer is B. Assess the patient into the semi-Fowler's position. Why? If the patient is a patient may aspirate, right? So the food is regurgitating, right? And what will happen? Some patient may have aspiration. So you have to keep the patient in semi-Fowler's position. Okay. Assess the patient to semi-Fowler's position. Why? To prevent aspiration. Okay. Let's go to next question. During a health visit, you are helping a patient develop a list of foods they should avoid due to GERD. Which item in the patient's pantry should be avoided? Select all that apply. Hot and spicy pork rings, peppermint, green beans, tomato soup, chocolate fondants, almonds and oranges. Okay, you already know in GERD when I discussed it with the acid reflux, which are the foods that you have to avoid or you have to teach the patient to avoid. Okay, here which are the you select which are the foods that you are going to avoid, because it may induce acid because patient is also having heartburn, which some foods are not good, right? So which answers you are going to give? Yeah, you're going to avoid hot and spicy, answer A, and peppermint patties, and D, tomato soup, because it contains tomato soup also may induce heartburn, right? And the chocolates and orange, citrus fruits. These all are the right answer. You're going to, A, B, D, E, G. These are the right answer. Okay, green beans and almonds you can give. It's okay to give the patient with the GERD, but these hot and spicy, peppermints, tomato soup, chocolates and oranges are induced acid reflux. Okay. Answer is A, B, D, E, G. Next question. Answer 5. After providing education to the patient with the GERD, you ask the patient to list 4 things they can do to prevent or alleviate signs and symptoms of GERD. Which statement is incorrect? Here you are going to see the negative answer, right? Incorrect answer. That's fine. Better to know the content. I'm repeating again and again. It's always to know content is very good. So you can answer the right one, right? Option A is it is best to try consume small meals throughout the day, then eat large ones. B, I am disappointed that I will have to limit my intake of peppermint and spearmint because I love eating those types of hard candies. Answer C is it is important I avoid eating right before bedtime. D, I will try to lie down after eating a meal to help decrease pressure on the lower esophageal sphincter. Here you have to look for 3 positive answers and 1 will be the incorrect answer. You must know what is the true or false. Same like it is a true or false. So you have to avoid large meals, right? Eating large meals is not right. So you have to avoid large meals. Take a small meals throughout the day is the right answer. And I'm disappointed that I will have to limit my intake of peppermint because I love eating those types of and here she is avoiding peppermint taking. Okay. And C is it is important to avoid eating right before bedtime. Yes, of course. Before 2 hours you have to have your meal. Here the answer D is I will try to lie down. No. You should not lie down after eating a meal. Okay, to help decrease the pressure. No, it's wrong. You should not lie down after you have food. Okay, this correct answer is answer D. It's the incorrect answer.